All right, I'm starting that process. So when it says that are on, you'll be ready to go, Katie.
Okay.
We are on.
Good. Councilman Shealy asked me to chair the meeting today. He's with us for as long as he can be, and then we'll need to drop off for a prior commitment. So, for any who don't know me, I'm Katie Richardson, the medical director for the Low Country region of what used to be DHEC and is now the Department of Public Health. I'd like to welcome everyone to the meeting and call this meeting to order. Our first order of business is to approve the minutes from our September 4th meeting. Would someone like to start that process for me?
Move for approval of the minutes from September 4th.
Thank you, Councilman Shealy. Would anyone like to second?
Second.
Thank you. All who vote to approve the minutes, please raise your hand or say aye.
Aye.
Aye. Anyone opposed? All right, minutes are approved. Thank you very much. We are very excited today to have Stacy Mathis with her. She is Chief of Staff for the Charleston Dorchester Mental Health Center. Jennifer Brush is out of town and sent Stacy Mathis in her stead to tell us what's going on now with the Charleston Dorchester Mental Health Center. That would be great for us to know and continue to share with our community. Stacy, the floor is yours.
Thank you, Dr. Richardson. Last month was National Suicide Prevention Month, and so we were super involved in the community with lots of things going on. Just wanted to bring a few things to y'all's attention. We are 2 years into my center rolling out 988 for South Carolina here. We have a team that responds 24/7 to calls to the National 988 suicide line. They're here on Charlie Hall Boulevard. That has been a progress, but we are pretty much fully staffed with full-time employees, and then we fill in shifts as needed with other employees to make sure that we are open 24/7, 365. In the past 2 years, we've answered 81,000 calls and have been rolling out new options for that. As time rolls on, there is now a text option and a chat option as well. There are special lines for different special populations. So there's a veteran line, there's an LGBTQ line, there's a deaf and hard of hearing line that's part of that. One new piece is, you may have seen recently, they're rolling out the geo-tracking component of that. So with most folks calling using cell phones, right, you may be in Charleston, let's say, but have an 864 area code on your cell phone. And so we try to route calls to the area that would be providing the most helpful information. So it's not super helpful if you have a cell phone number, let's say from Ohio, but you're living here in Charleston. And so the geo-tracking feature will allow the calls to be routed to the most appropriate facility based on where the call is originating from and not your area code. So that's a new feature that will really help, we think, in getting accurate local contacts and resources to callers. So we're real excited about the progress that 988 platform has made. You may know that we've also had a mobile crisis call center that also operates out of our facility, where we are answering calls from across the state and deploying as needed our mobile crisis teams across the state. So that's a little update on that. Also just wanted to bring to your attention, Jennifer sent Mr. Wieters some flyers with some information that may be helpful for your employees or your citizens. One is an interactive screening. It is called the hopeconnectsyou.org platform. It allows you to do an anonymous questionnaire, sort of a self-check questionnaire, and then it will connect you with therapy resources anonymously. So that's a way that you can receive, sort of anonymous assistance as needed. There is also a flyer that was included about Helpful Minds, which is a like 200 plus topics. So if you want to reach out to Hopeful Minds, you can find information on burnout and stress and anxiety, dealing with complicated medical diagnoses, things like that. So that's also a resource that the flyers should be able to help folks connect with, sort of without having to actually go into a mental health center and get assistance. It's a first step. Any questions about that information?
So is that last option that you talked about, that's free of charge, those that information that's online?
Yes, it's called Hopeful Minds. And you can visit hopefulminds.crediblemindcom, and that'll get you those resources. We will also be at the City of Charleston Employee Wellness event, the 18th, 16th of this month. So we'll have information on that as well there.
Great, thank you.
Absolutely.
And Stacy, that's available for anyone in the public or just city employees?
Anyone.
Oh, wonderful. Okay. Any other questions?
Clarification, the 16th is for city employees only, but the program is for everyone.
Yes, correct. Sorry. Yes.
Thank you, Stacy. Other questions? All right. Well, we really appreciate you joining us today. Feel free to come back anytime. And feel free to stay today as well. So I think I'm actually on the agenda next for community health updates. And one thing I want to, Paul, can you pull up my slides? I think I will start with the Fast Track Cities initiative. So we've talked about that before with this group, but in 2019, Mayor Tecklenburg signed on for Charleston to be a fast track city. You can go to the next slide. And what that really means is a partnership, international partnership between cities. It started in Paris, and cities are all trying to reach what we call a 95-95-95 goal by 2030. And what that means is it's around HIV, ending the HIV epidemic. And the first 95 is 95% of people living with HIV knowing their status. The second 95 is 95% of those on antiretroviral therapy or on the treatment for HIV. And the last 95 is 95% of those being virally suppressed, or essentially having no circulating virus that can be detected on a blood test. So it essentially, that last 95 would mean that 95% of those people would not be able to transmit HIV to another person. And it also keeps that person living with HIV healthy and essentially able to live a normal lifespan with treatment of HIV. Next slide. So up until recently, there's a dashboard on the Fast Track Cities website, And this was the Charleston data for 2021. And there's always a delay in this data. So up until recently, this was the most recent data. That 84% is set by the CDC. So that's an estimation that out of 100 people living in South Carolina, 84 of those living with HIV would know that they have HIV. They would have been tested and would have been given their results that they were living with HIV. The second number says of those who know they're living with HIV, 74% or 74 out of 100 would be on antiretroviral therapy. And the third number means that of those on antiretroviral therapy, 87% would have been virally suppressed. And then right at the top, it says the estimation for the Charleston Metro Center is that we have, and what we call the Charleston Metro Center is Berkeley, Dorchester, and Charleston counties. So in 2021, approximately 3,608 people were living with HIV. Next slide. And so we have just finished, the Department of Public Health, calculating and submitting the data for 2022. That first number is the same because the CDC only recalculates that number every several years. We're hoping that they're going to do that again this year. The second number fell from 74% to 71% of people that were on antiretroviral therapy. And we don't actually have that number for South Carolina. So what we use as a proxy for that number is those who are actively in care. So it means that they have been to see their provider and they've had labs done within the past 13 months. So that's how we calculate that number. And then the last one, the viral suppression, there's a lab test called a viral load. And that number has fallen from 87% to 74%. And so generally, I would say these numbers are not going in the right direction. And now we're in the process of thinking about, why might this be? Some ideas that we've had here at Department of Public Health, and I'd love to hear if anyone else has ideas on this call, is certainly the COVID pandemic. I think we know across a variety of infections and diseases led to decreased access to care. So less people going to see their provider, having labs done. In 2022, we were still in the midst of the pandemic. There's also been some change in how we analyze the data. So the CDC puts out guidelines. They want to be able to compare, one state to another. And so that did lead to some change in the way that we compute these numbers. Not at least our Department of Surveillance doesn't think it should lead to too much change, enough to be the reason for these changes, but certainly could have had an impact. And then the third thought that we have explored is whether there was a change in basically clinical pathways. So was there a change in the recommendations for, say, how often labs were checked, how often people were seen? We haven't heard that from our providers, but that was another option that we are exploring. And then, of course, 1 year doesn't constitute a trend. So we'll certainly be looking forward to the data for 2023 to see if this sort of worsening of numbers continues. But does anyone on the call have any other thoughts for why this might have occurred in our Charleston metro area? Morgan, I'm looking at you. In case you can think about it, let me know if you have any thoughts. But the last thing we do hope to do is go back to the Fast Track Cities initiative and actually ask them to help us compare these numbers with other cities in the Southeast. Because again, if we see similar decreases across the Southeast or across the US, then it would probably suggest more sort of the pandemic related causes or potentially a change in clinical pathway as opposed to something specific to the Charleston area and how we diagnose and treat those living with HIV. You can go to the next slide. So this is some of the things that the city of Charleston has done to support our Fast Track Cities initiative. We, Department of Public Health, along with our partners, update the data yearly. I am very grateful to Mayor Cogswell for providing us with a photo and a quote to put on the website. Every city does have that, showing support for the mayor for this initiative. We are provided free virtual registrations to the Fast Track Cities Conference. It was in Paris this year. Unfortunately, we did not have money to send anyone there, but we did have 5 free registrations so that members of our Tri-County Shape group could listen in and hear what other cities are doing. We have always encouraged and been very grateful for the response from Mayor Tecklenburg, and we look forward to now Mayor Cogswell supporting events and awareness days in the Charleston area. We've also been grateful for the city and county to using their social media to support prevention efforts. And this year we'd like to, and this was really Paul's idea, we'd like to start involving other mayors. We've already had some initial discussions with Mayor Burgess. Some of our partners have, and so we'd like to start with him. And then just this week, heard that the mayor of Hanahan may also be interested. And so those are 2 initiatives this year in addition to continuing our previous efforts. Next slide. So this is Mayor Cogswell's photo and quote that's on our Fast Track Cities website. Again, I want to thank everyone for helping to make that happen. Next slide. And then, so Tri-County SHAPE, SHAPE stands for Sexual Health Awareness, STI Prevention, and Education. And that's really a partnership between Department of Public Health and many of the entities in the Charleston area who address sexual health and HIV and STI prevention in our communities. And so really the Fast Track Cities grew out of this group. And these are just some of the things that we've done recently. We share surveillance among the partners. There has been an increase in syphilis, and we've certainly talked about that, and increase in congenital syphilis. And so working on that's entirely preventable. And certainly working to make sure that pregnant women are getting tested for syphilis and treated appropriately. We promote free testing days. This is the next one coming up, which is in honor of Hispanic Heritage Month. The free testing day is for people of all races and ethnicities, but any health department will offer free HIV, STI, and hepatitis C testing on this day. We do encourage appointments, and that's the appointment line number there. Also, you can go to the oh, sorry, let me finish this one. So our work group members present at many conferences around the state and outside the state. In addition to promoting free testing days, DPH also has at-home testing supplies free of charge that can be ordered through our website. We've had teleprep, so basically telehealth to provide PrEP, which is pre-exposure prophylaxis to prevent HIV as a partnership with MUSC and Department of Public Health. U equals U is basically saying that those who are undetectable, so have an undetectable viral load, are not able to transmit the infection. That really helps to address stigma around HIV. We continue to promote that fact, which has been well proven in the literature. There's a hepatitis C telehealth webinar. We're really trying to increase the number of primary care providers willing and able to treat hepatitis C. It is curable. It is the only hepatitis that is curable, and it's, you know, increasingly easy to do, but this group really helps to support primary care physicians if they have questions about a patient they might have. Mpox is still around, and we promote Mpox and HPV vaccines. And finally, PrEP, we're actually going to start providing PrEP ourselves in the health department clinics. And then DoxyPath is a pretty new a new initiative to provide those who are at higher risk for sexually transmitted infections, antibiotic, doxycycline, that they can take shortly after sex to prevent some STIs. And then last week, we, as part of PrEP Awareness Week, there was actually testing done for STIs and HIV at several of our local colleges, including the College of Charleston. I know we tested almost 200 people for STIs. Another partner was there testing for HIV. They had several other health initiatives going on at that time. There was also HIV testing at the Citadel. And then our plan is to reschedule a Trident Tech that fell through at the last minute, but we hope to test there as well. And then we had it's basically a fashion show of outfits made out of condoms, again, to address stigma. That happened back in June and will happen yearly. And then every World AIDS Day, we do honor those who have passed away, and also use that as a time to bring community members together to celebrate, the strides that we've made, but also remember those who have passed. And then you can go to the next slide. And we also support Pride events in the area. So there's Park City Pride, there's Charleston Pride, and there's Charleston Black Pride. And Charleston Black Pride is coming up at the end of this month. This is some of the events happening, and then there's a website for more information. Regina Duggins is the coordinator for this event. Anyone who would like to participate or hear more about it, please reach out through the website to her. You can go to the next slide. So some of these slides may look slightly familiar. Louisa Ramirez, who's our director of Tri-County SHAPE, came and spoke in June around National HIV Testing Day. And I used some of those slides with the updated information. So those are some updates about our fast track cities and Tri-County SHAPE. Any questions I can answer about those activities or that work? All right.
Katie,
Yeah.
I know the one slide, and I'm gonna send out all those pictures, but the one slide about the free testing, that was October the 15th. And that's at
Yeah.
y'all's location?
It's at all health departments, but the closest one to Charleston is our North Charleston Health Department on Rivers Avenue, right across from the old Navy Hospital. But we also have sites in Goose Creek and Monk's Corner, Somerville, Walterboro. So those are some in the area for anyone who may say work in Charleston but live outside of this area.
And a question going back on the numbers of the 95, 95, 95 that we're trying to reach, and our numbers being in the 70s. The question is, I guess most of that, if I remember correctly, most of that's in the younger population.
Well,
the 18 to 40 age group.
Well, yeah. So certainly new infections, the age group often most affected are younger people. They're also people of color, but that's not exclusive because we're really there when we're looking at, the number of people living with HIV. Some of those people with effective treatment have been living, for decades. So I would say that total number of 3,600 is not concentrated in younger people. But when we talk about new infections, it happens across all races, all ages, all genders. But we do see a disproportionate increase in HIV infections in those younger age groups. That's part of the reason for the outreach to college campuses, testing there.
Do you think, or I wonder, now that treatments have gotten better and we have more options for treatments, do you think that that could be not desensitizing people a bit, but making them feel more complacent that, oh, well, there's something that'll take care of it if it happens? Or, I mean, do you think there's a component of, now that we've got help, it's maybe not as critical in their minds?
Certainly there could be. What I tend to experience is that that message still hasn't really gotten out. I mean, I feel like the thought that HIV is a death sentence, it is, even though that's definitely not the case with very effective treatments that are often only, one pill a day or even an injection that is much less frequent than that, make HIV much easier to treat. I think that message and the message that those who are on effective treatment are not able to transmit HIV, really, I hope that those messages continue to spread to the public, help decrease the stigma such that those living with HIV are willing and able to come in and get treatment, and those who have not had a test are not afraid to do so because they're afraid of what the result, may be.
Back, Katie, one more. Some of the primary partners around our community, we know MESC and Roper St. Francis. You want to?
Palmetto Community Care is our third Ryan White provider in the area. And then we also look to, our military base, our prevention partners like Planned Parenthood, the Empower program, and then, a variety of folks at Department of Public Health, obviously College of Charleston and the Citadel and other, the school district. Our SHAPE partners went in and spoke during sort of the teacher education time right prior to school to those who will be teaching sex education to all of our students, make sure that they have the resources they need, doing some role playing around how to address questions that kids might have, that sort of thing. So those are some of our partners in the community. Certainly the city of Charleston. Thank you, Paul, for being an active member for many years.
Thank you.
Right. I just have a few other updates, not related to that, and then I'd like to open it up for community updates. And I think Dr. Durst let me open the
Hi.
Hey,
Katie, I'm sorry I'm in between some stuff at work, but I can I put in the chat that I can talk about it for a minute.
Yeah, sure. Go ahead. And
I'm
then
sorry I
I'll
don't
go
have
back
my
to a few other updates.
Yeah, I'm sorry I don't have my video on.
No
But we had a big initiative in September around Labor Day weekend. Some of y'all might have been a part of it. It was our Low Country Jazz Festival put on by the Closing the Gap in Healthcare, which is a branch of our division, the Charleston County Medical Society, with Dr. Thaddeus Bell, who does a lot to help with disparities in healthcare. It was successful. It was at the Gill Yard. It was a sold out event. It was on Friday night, Saturday, and Sunday. raised a lot of money and awareness for scholarships to help people that are studying health and promoting disparities in healthcare. Is a wonderful initiative. For those of y'all that help support us and were there, we really thank you. And Dr. Bell was honored for his work on Saturday, and it's just a great initiative. So that was really exciting. Every year, like I said, they give scholarships mainly to minorities that are at mainly MUSC, sometimes at Trident, but that are going into the healthcare field. So that's important. And it's not just physicians, they've been given to dentists and nurses and other healthcare providers. So that's been a great initiative that we've always supported. And Dr. Thaddeus Bell and our group and board have also been on the radio a lot. Some of y'all might know some of his programs that he's out there really just talking about disparities in healthcare. And you mentioned a little bit, Katie, about just definitely, I mean, not a little, you talked a lot about HIV and vaccines also. So that was very important. And Dr. Robert Ball, Katie, who of course, at Public Health, wrote different articles about the emphasis for COVID vaccine and flu vaccines right now. We are still seeing COVID, and we're starting to see the flu. It is October, so it's a prime time to get the flu vaccine. There was also a little article about, and I'm sorry if you mentioned it, Katie, too, about the RSV vaccine, which we recommend for 60 and up, especially more vulnerable patients and kids. Right now, it is a one-time vaccine. You don't need a booster until later. So that's important. And then another big division of our Charleston County Medical Society is our School and Health Wellness Initiative and committee, which is very robust. We have worked with a lot of the nurses in the area and the schools. They have been working on the initiatives of getting AEDs in the schools, also working with CPR. I know that one of the teachers or the nurses, it was in Post and Courier, at one of the schools, helped get a grant to bring CPR to the faculty there. So that was a big initiative, not just through our organization, but working with the nurses at the schools. So that was wonderful. And then unfortunately, because we are seeing more drug overdoses and problems, we are getting, and I think we are getting the initiatives with Narcan in the schools. Unfortunately, we have to do that, but it has saved some lives. And another initiative that we're working on that they have in North Carolina, and we're trying to work, and if anybody can help us, is they're trying to help kids that have been involved in some kind of trauma. Unfortunately, we see children that maybe the morning before they go to school, they were involved in a violence or they saw somebody overdose or something. And they have to go immediately to the school. And while they're at the school, they have to pretend like, getting their work done and all. So there's some initiatives trying to work, following a program in other states where we work with the police and the health department. So if that student was in some traumatic event before school, secretly, if it's given to the schools, so that the teachers and all know that maybe if that student is putting their head down, is because they've gone through maybe they were up all night with their grandma in the hospital or they saw something traumatic. So give them a little slack, and then also work with them with some extra help and counseling. So that's a big thing. And Katie, you might have mentioned too about, October is breast cancer awareness month. Katie, maybe more other people. I know that there's some vans going out to help with this initiative, and we're seeing more people wanting to do this. We're trying to work with, I know, like you said, Roper, MUSC, East Cooper, and even some of the freestanding places to make sure women are getting their mammograms, because the biggest thing is, as you said, people have kind of delayed their care for a couple of years and now trying to get it. And maybe some of y'all have seen in the Post and Courier and the initiatives about dense breast tissue, and how that can increase the risk. So we're trying to put out more initiatives, with that. And we're working a lot with the medical students in the area promoting a lot of public health, trying to help with their CARES Institute and working with the Feder clinic. That's good. So thank you.
Thank you, Dr. Durst. Lots of great information. Actually, I can piggyback on the Breast Cancer Awareness Month and talk a little bit about the van that MUSC runs, the MUSC Mobile Health Unit. We are partnering now with that van to come to health departments. And actually in this month, October the 8th is when the van will be at the Charleston County Health Department. Appointments are required. There's the number for making that. The appointments are from 10 to 2 on that day. For those with insurance, it does need to be at least a year since you had your last mammogram for insurance to pay for that. And there is a program, the Best Chance Network, that will cover mammograms as well as pap smears for those who are uninsured. So Paul will send this out, but that QR code provides more information about that. And the mobile vans, as Dr. Durst said, are not only at health departments, they're all around the community. But these are some of the dates where they have been around the Low Country and dates where in the future they will also be in Colleton and Bluffton and start over again. So they'll be here again soon. And then also to follow up with Dr. Durst's comment about the Narcan. So it is in schools and also there will be an event. There was an event unfortunately canceled during the storm last week. There was a variety of partners to have a drive through Narcan distribution event, but there will be another one hosted by the MUSC College of Pharmacy on October the 30th. It will be from 12 to 1. It will be open to the public. DPH is helping to provide Narcan as well as fentanyl test strips for that event. And the flyer is not yet available, but I will send that to Paul to share when it is soon available. And lastly, on that same front, October 26th is a federal take back day. So what that really involves is dropping off unused and unwanted medications to prevent drug misuse before it starts. And so that will be happening across Charleston, and more information about that will also become available. It's not just those days. Many pharmacies, MUSC, some first responders do have bins, almost looks like a mailbox, to take medications at any time. So you don't have to wait till one of those days, but that is a time where it's really being promoted that this is an important strategy in our communities to decrease drug misuse. Good segue from what much of what Dr. Durst had to share. That's what I have to share. I'm happy to take any questions about that. And then I'd like to open it up to those on the call who have anything to share with this group and with our public. So any questions first?
Just reminders for you,
Good.
flu and RSV.
Thank you. Yes.
COVID.
So Dr. Durst did mention vaccines. Flu vaccines are available. I do recommend getting a flu vaccine in October, and we are now there. please consider doing that prior to the end of the month. Anyone 6 months of age and older is recommended to get a flu vaccine every year. There are different formulations. Those who are older are recommended to ask about formulations available for those who are 65 and over in our communities. COVID vaccine, the new booster formulation is also available. If you've not recently had COVID, that is recommended again for everyone 6 months and over. If you have recently had COVID, you can wait around 3 months or so prior to getting that booster. And then RSV, as Dr. Durst said, there is a vaccine. It's not exactly a vaccine, but it works as a vaccine for infants to provide protection against RSV. And then there is a vaccine for pregnant women. So pregnant women receive it between 32 and 36 weeks of their pregnancy. Then the infants are covered. They don't also need it. It helps to, really provide coverage for the whole family if it's taken by the pregnant woman at the end of her pregnancy. And then anyone 60 and over with other medical conditions, everyone 75 and over, regardless of their health status, is recommended to get that 1 dose of RSV vaccine. So that's my vaccine spiel. Thank you for reminding me, Paul. Any other questions for me before we open up the floor? All right. Well, feel free to just jump in and share what you have to share with this group.
I don't know if Angela Johnson wants to promote her event coming up in November.
Good morning, everyone. Paul, yes, I do. I was moving my mouse around to put my camera on and unmute myself. But good morning, everyone. I'm Angela Johnson. I am with Trident United Way, and also very much involved with Healthy Tri-County, as we are one of the core partners for our coalition, Healthy Tri-County here, that represents Charleston, Berkeley, and Dorchester counties. Just a reminder, if you have not heard, that we will be hosting the 2024 Health Symposium, which will take place next month, November 7th at Trident Technical College. It's an all-day event from 8:30 to 3:30, and the theme will be around health equity and collaboration amongst community partners. We've got some great speakers lined up. There are opportunities to get continuing education credits for nursing professionals, social workers, and community health workers. It's a free event, so even better, and we'll serve you lunch and breakfast. So we would love to have your support by your attendance. We are still looking for sponsors, so if that is something you're interested in, please feel free to reach out to me, or you can go to our website at healthytricounty.com, and there's more information there, and you can register through our website as well. Are there any questions I can answer about that day?
I'll try to provide a link again for that.
Thank you.
Go ahead, Paul.
I'm good.
Hi,
Thank
Paul
you,
and
everyone.
Dr. Richardson.
Yes, go ahead, Jonathan.
Yeah, this is Jonathan Kessler with VA. So I'm having bandwidth issues. I can't use my camera. Just wanted to share that in November, the Veterans Benefits Administration, separate from the Healthcare Administration for which I work, is hosting a Veteran Experience Action Center, otherwise known as a VAC, just because we love our acronyms so very much. But it's going to be held November 14th through 16th at the Latson Fairgrounds. And what this is, it's a benefit fair to allow those veterans that have been enrolled in or applied for benefits to do so. And there will be on-site medical examiners, which actually helps to expedite claims. Not that this is going to be the case for all veterans, but there may be some that will go in for the first time, apply for VA benefits, and actually leave with a rating. How this also benefits our veterans is those that maybe previously didn't qualify and now do, they're then eligible also for VA healthcare services. So a lot of this has to do with the Biden administration pushing the PACT Act, which is increasing benefits for those that have had exposure-related illnesses and after effects. So what I'd like to, it's a big deal. They've held it in Columbia and other places around the state. This is the closest one, I believe, to our area. So what I can do, Paul, is I will share the flyer with you if that's something you wouldn't mind putting out. Just want to get the word out there and just increase awareness. So this will be something for some veterans who have applied in the past, was not found to qualify. They may now qualify in the case that they hadn't in the past. So it's pretty exciting. So I'd like to get the word out. That's all I got.
Absolutely. Thanks again, and tell us where that's happening.
Yep, it's going to be at the Latson Fairground, and it's November 14th through the 16th. So basically Thursday through Saturday.
Great. Thank you, Jonathan. Who else would like to share? Maggie, there's always something going on with the school districts.
Hey, good morning. We are excited to be moving into the fall. I can't believe first quarter is drawing near to a close already, but we are in full swing, and we have several community events coming up. So we have a coffee talk series with the superintendent that occurs monthly, usually on a third Wednesday, and it rotates locations around the county from 9 to 10 a.m. And that's where any stakeholders can come out and engage in conversation with our superintendent and leadership. And similarly, we also have in the evening monthly, typically the second or third Thursday, rotating in the county, regional meet and greets, where families can come out again and engage with our superintendent and leadership and receive specific updates for their part of the county across all of our areas, from academics to HR to operations, capital projects and improvements, and ask questions and dialogue. So we encourage all of our families, staff, community members to come out and join us at these events so you can ask questions and just get to know our leadership a little bit better. And then, of course, we've got school in full swing after some of our weather disruptions, and we are very thankful that all of our campuses have power restored to them over the weekend, and we were able to go back to school as planned on Monday.
Thank you, Maggie. And I'll also just put in a plug that there are flu vaccines that will be happening also at many of the Charleston County School District schools. Much of that is being led by the school nurses, but the Department of Public Health is coming in to cover some Title I schools as well. So if that's a good option for parents, rather than going to their provider, we welcome those kids to get their vaccines at the schools.
Yes, and I have one more quick thing. So on Monday, we are going to celebrate the grand opening of our new International Welcome Center, and that center is located at Pinehurst, but it serves all families in the district who are new typically to the United States, who are multilingual learners. And so at that center, families can come in, they can receive registration assistance with our schools. We provide transportation assistance to get families there. And then we can also screen for English language support. We can make community resource connections and provide wraparound services, as well as support international transcription processes, and provide free vaccinations by appointment. So again, that's located at Pinehurst Elementary. We are serving families already. This is just kind of our celebration, our big grand opening. And I'll share that resource with the group as well, but we're really excited to have that this year, certainly as our multilingual learner family population grows in the area, and we want to have as many resources available to support all of our families and students.
Thank you. I had not heard about that. So that is great news, and I look forward to hearing more about it. And we also provide, I assume those vaccines are only for school children, or are they for adults as well?
That's a great question. I think it's just for students, but I'll check and get back.
Okay, yeah. Well, if that is the case, we do provide the vaccines for adults who come through the refugee program. So so feel free to send them our way if you have adults asking. Thank you. Morgan, what's going on at College of Charleston in public health?
Hi, good morning, everyone. That's a great question. I'm on maternity leave right now.
Oh, well, congratulations.
Thank you. I'm a little less connected at the college. I am on the board for Charleston Move, so I know a very different topic, but promoting safe physical activity. We have a big fundraiser on Thursday, November 7th called Pedal and Panache at Edmonds Oast. So that's a big event for us. There are also a lot of projects coming up, and there's one with a bridge on Johns Island. There's some new designs being proposed for the Bridging the Ashley project for the bike pedestrian bridge from West Ashley to downtown Charleston. So I would just recommend following Charleston Moves in the city on social media accounts to see those, and let your council people know if you really want to see that bike pedestrian infrastructure and what your preferences are. When those big projects come up, it's important to kind of have our voice heard so that it's not left out, because those are projects that are, long-standing into the future. So that's one thing that's kind of on my mind and coming up here in the future. Thanks, Katie.
Yes, thank you for sharing that. Charleston Moves does great work, and we certainly I think the pedestrian and bike infrastructure is a priority and should continue to be a priority. Certainly those areas, and we still continue to think about the North Bridge area also. I know Charleston Moves worked hard on a grant that unfortunately did not get funded, but hopefully, as is true with many grants, with persistence, hopefully something will come through.
Yeah, we have to advocate to include it when we have these big infrastructure projects, or else we'll really miss a way to connect our communities and provide alternate transportation. And, the one from West Ashley to downtown, one of the main ideas was to provide a transportation option. Of course, everyone won't take it, but to the medical district supported the grant. And so just really making sure that stays on track and stays funded is important to a lot of folks.
Thank you. Latoya, is that Latoya from Fetter that's on the call? You want to talk about what's going on at Fetter?
Hey, good morning, Dr. Richardson. Good morning, you guys. This is Latoya Hall from Better Healthcare Network. We are focusing on our advocacy program, trying to reach out and partner with different partners within Charleston, Dorchester, and Berkeley County. We also focused on just increasing our new patient intake. We offer primary services as well as dental services to any patients, uninsured, underinsured patients. And so we really want you guys to push to get those patients in so that they can receive the needed services that they need.
Thank you, Latoya. And are you offering flu, COVID, and RSV vaccines?
So we are currently offering flu vaccines. We're waiting for our shipment from the Department of Public Health for our COVID vaccines.
Okay.
And vaccines, we do not have that yet as well.
Okay. All right. Thank you.
You're welcome.
Good to see you.
Good to see you too, Dr. Richardson.
I see a Flint in Charleston. Would you like to come off mute and tell us what you have to share around health and wellness for the Charleston area? They may just choose to listen in today. That is totally fine. I think that we've covered everyone. If I haven't, please let me know. April, would you like to share any more? I know we were talking before we went on. We're being recorded, but any more about the health of city employees?
Well, right now we're gearing up for flu season and COVID season, so we're trying to get the word out about that and get our vaccinations going. So that's a big push for us right now. Our employee health fair is October 16th, and so a lot of the things that we're doing there to support employee health are vaccine related. So we feel like we're sending the right messages there and getting the right resources out. So we're excited. We know it's going to be a busy season, but we're excited to have as many employees that are engaged in healthcare as we do.
What you're doing for public health and our social determinants of health in the community. I want to thank Councilman Shealy for asking me to fill in today, and Paul, of course, for pulling all this together and getting all the resources out to everyone and choosing our topics. And we will reconvene in 1 month. Look for Paul's follow-up emails and also the invite for next month. And Morgan, thank you. That is helpful. Public health interns. I know Paul has had interns. I've had interns. They are wonderful. Good way to really expose students to public health in action. So please consider.
I'll speak from personal experience. The ones that we've had lately have been amazing. Very intelligent, very helpful, come with a lot of good ideas. So it's a great way to give them experience, but we get a lot of benefit from it.
Thank you. I really appreciate everyone's time. Any final comments before we sign off for the month?
Just everybody, I know everybody's doing a lot to remember our neighbors to the upstate in North Carolina, and let's just keep them in our prayers and thoughts and actions as much as we can.
Absolutely. Thank you, Paul, for that. And we'll see everyone next month, hopefully sooner, at the Charleston Moves event and some of the vaccine clinics. And let us know here at DPH if we can ever be of assistance. Thanks, everyone.
Thanks, Dr.
you.
Richardson.
Dr. Richardson, thank you.